Hemorrhoids, hemorrhoids, do you have hemorrhoids? We can maybe manage them. Hi, I'm the hottest ambassador for Priceline, Tanya Hennessy. Welcome to The Awkward Ask, where it's also awkward before the asking. Today's episode, we're going to talk about hemorrhoids, and I'm joined by my best friend, Lynn. I'm joined by a colleague, Lynn.
Oh, I'm happy with best friend.
Lynn!
Hi guys, welcome back to The Awkward Ask.
This one's a bit heavy today. Let's start with what are hemorrhoids? Because I've sung a very good intro song, but I don't 1000% know what they are.
So hemorrhoids are inflamed blood vessels that can present as lumps on the inside and the outside of the anal passage.
Are hemorrhoids painful?
Yes, they are.
Yeah, they look really painful.
Yeah, they are really painful and they can sometimes cause bleeding.
There's more than one type of hemorrhoids. I believe there's 3 from a
Yes.
piece of paper I sort of glanced at.
Yeah, so you can categorize hemorrhoids into 3 different types. You've got your internal ones, which you can't see, but you can feel. And often they bleed. So you can get, the stool motion and you can get the blood on the stool or when you wipe. Then you've got the external hemorrhoids, which sit around the entrance of the anus. And then there's the prolapse one, which is the one that is visible. So they're the ones hanging out. And they can cause discomfort, pain, and a lot of people can definitely be embarrassed about it, but treatable.
So what causes a person to end up with hemorrhoids?
So essentially, because it's a blood vessel in that the anal passage, anything that strains can cause it to burst or to pop or to protrude, creating that lump. So if you've got a poor diet and you're constipated and you strain when you go to the bathroom, that can cause a hemorrhoid. Now, it doesn't have to be one that starts bleeding, but it can cause a bit of discomfort. Now, if it does start bleeding and you pass stool, you'll be able to see it when you wipe or even in the stool as well. Now, that's quite common, but if it's something that's ongoing, then you need to see a pharmacist and we may refer you to a doctor because it could potentially be something a bit more serious.
And what about pregnancy? How does that occur?
So with pregnant, hormone changes.
Right.
Yep, the pressure of the growing baby as well. Some women or most women would take iron supplements or pregnancy vitamins which have iron in it, and that can cause constipation as well. So I took it when I was pregnant and that caused a bit of constipation, unfortunately. So I had to speak to my doctor and change it up to something else.
Yeah.
Weightlifting can cause hemorrhoids, especially if you've gone from a lower weight to a higher weight and your body's not used to it yet. That straining can cause a hemorrhoid. So even when you're moving heavy objects, you need to make sure you bend your knees so that you're using your core.
I think this might be a common question that people are thinking, that are watching. Does anal sex cause hemorrhoids?
I don't believe it can cause hemorrhoids, but if you do have a hemorrhoid, anal sex could possibly aggravate it. Or make it worse, especially if it's an internal one where it hasn't kind of started bleeding. I worry that it could potentially exacerbate the symptoms.
What is sort of the most manageable way to deal with something like hemorrhoids?
So definitely lifestyle. Okay, you need to make sure you keep hydrated, 2 liters of water a day to keep the stool soft. Plenty of fruits and vegetables in the diet.
Fiber.
Yep, fiber. But the tricky thing with fiber is when you're constipated, you don't want to be taking fiber at that point, because what happens is you can bulk up the stool, making it harder to push. So if you are constipated, the best thing to focus on is softening the stool. So stool softeners, plenty of water, adding that back into the diet. And the other thing also, and we take this for granted, is movement. Yeah. Exercising and just going for a walk and moving, just that motion can help with constipation and therefore prevent hemorrhoids as well.
And what is the best way for somebody, if they do have hemorrhoids, what's the best way to communicate with your pharmacist?
So the first step is to come in. Come in, speak with your pharmacist.
Get off the internet, don't Dr. Google.
That's right. And we're very comfortable discussing this with you because the treatment options are there. Come approach us, we can speak privately, everything is confidential. Depending on your symptoms, we could recommend a few things. So the most important thing I like to discuss is obviously prevention. So after we look at the treatment, we'd look at the prevention as well. So there are creams, internal and external creams. So the internal creams often comes with a little applicator. That way you can get the cream inside the anus as well. You can also use creams or suppositories that we keep in the fridge so that it keeps its shape, and also that cooling sensation when you insert, and it gives you that instant relief. They work really well for prolapse hemorrhoids because they can kind of push things back in. The main treatment there is the steroid cream or the anti-inflammatory component of it, and often these creams are combined with a barrier cream so that it can protect it, because remember, you can't stop yourself from going to the bathroom and, you know, making a number two. So won't that kind of get rid of the cream? Yes, it can, but that's why they've added the barrier cream to kind of protect that. The other thing that most of these creams have is a numbing agent.
Perfect.
Yeah. So that combination will help to treat the symptoms. But again, I like to focus on the prevention. If you speak to your pharmacist, and if you're, willing to bring up these uncomfortable conversations, then we can treat it completely. The whole treatment.
Why is it so important for people with hemorrhoids to go see a pharmacist?
It's important because it's uncomfortable to live with. You don't have to live with it, especially with a prolapsed hemorrhoid. The most important thing though to identify the issue is if you're bleeding, when you wipe or you can see the blood in your stool, if it's only for a short period of time, come in and we can sort you out. However, if it's continuous and even after treating, the blood is still there, it could be something more serious, in which we would definitely refer you to a GP.
Thank you guys so much for watching this week's episode of The Awkward Ask. I hope you've learned more about hemorrhoids, because I certainly have. Arguably too much, Lynn. We'll see you guys next week. And obviously, if you have any of these symptoms or you feel this discomfort of hemorrhoids, make sure you go see your local Priceline pharmacist or your GP. See you next week.
See you next week.